Start with a bit of housekeeping, but first I'm going to say hi, my name's Jo Silver, I'm a director at SafeLives. A bit of housekeeping today. The virtual rules still apply, even though we are starting to see each other in person, which is great. If I can ask you to keep your mute button on, just so that we can hear our guest speakers clearly and we haven't got to embarrass anyone with crying children, barking dogs and Amazon deliveries, as is the norm in our houses. There's going to be a chat box available, so whatever your questions, please do throw them in the chat box, because you'll forget about them maybe at the end for our question and answer panel. Also, we will put content in the chat box if any speakers refer to it, so that you've literally got the document in front of you and you can use that for whatever you want to. You'll need a little phone with you, a smartphone if you can, because we're going to do a very short exercise using your phones. And we've got captions available today, so we're more accessible to everybody. So that caption function is available if you want it. And we will also be recording the call until the question and answer panel, and we won't be recording that. We'll just be recording our speakers so that we can share that knowledge and expertise with our audiences. I just want to say a big thank you to Tamar, who's come to us last minute, who's juggling so many balls to get here today, because Carmen Nirvana were originally on your invite, but unfortunately the dreaded COVID got them, so they weren't able to be here today. So a big thank you for that. We've got lots of speakers today, as you can see, so you'll hear from lots of different people with very different experiences and approaches. But what we are here today to do is look at the local partnership board and needs assessment for the new Domestic Abuse Act 2021, and I hope that we can help you start thinking about perhaps what you might have missed, or hopefully asking you to share the good practice that you have been doing already with us later on. So that will be brilliant. So I think that's housekeeping done. There isn't any breaks officially in the agenda. So you'll obviously decide when you need to take a comfort break and get a drink and take us with you or not, depending how that works for you. I'm just going to briefly talk through who SafeLives are. So we're a charity and dedicated to ending domestic abuse. We collect data from across the country. We talk and work alongside practitioners in the domestic abuse sector. And as important as everything that we do is we talk to people with experiences of domestic abuse, always being led by them and asking them to contribute in everything that we do. That's our recipe for success. So we call that voice, data and practice, and that's how we've worked for the last 14 years. Our strategy is broadening how we are looking at domestic abuse. Sarah, can you move the slide on? Thank you. And again. Thank you. So at SafeLives, we talk about domestic abuse and seeing the whole picture. So for far too long, domestic abuse has been a victim's problem. Well, the victim isn't the problem, the victim is the symptom. And what we need to think about is understanding the whole experience of the victim survivor, not just their domestic abuse. They will have other strengths, they will have other vulnerabilities, but at SafeLives we want to understand what's going on individually for that person. We need to think about that person because just by the very nature of domestic abuse, there is a family involved, there'll be an ex-partner, siblings, parents. So we need to think about what the dynamics are for that person within that whole family, and of course never ever forgetting, holding the perpetrator to account for their behaviour, whether that's offering them support or challenging them through the criminal justice system. We also think about domestic abuse in the whole society, whole community, and that may be community in the broadest sense. So it might be an online community, it might be a rural community, it might be communities of same sex, and so on. So what is that community that those people sit in, and how does that impact on their experience, and therefore how can we help them better? And then of course we go big and wide and think about the data about domestic abuse suggests that it is a societal problem. It's not just vulnerable, poor people. Domestic abuse doesn't care about colour, it doesn't care about how much you earn, and it certainly doesn't care how confident you are. So we need to really start thinking on a societal basis that domestic abuse is not acceptable, and opening a conversation around it rather than it still feeling like it goes on behind closed doors. Our strategy to deliver the whole picture, the next one please, Sarah, from SafeLives is as broad as our vision, and we do not think for 1 minute that a small independent charity can change the world. We work with partners across all of our work all of the time, and in our strategy we talk about actually lengthening our lens, looking at domestic abuse. So not only looking at the whole family and the whole society, but looking at what we can do as a state and a system that's better to prevent domestic abuse, because it continues. The numbers are rising, and we're not really making any difference between how many people in our society are experiencing domestic abuse. We really want to turn the spotlight and the focus on the perpetrators, or those using dangerous behaviour in a domestic abuse setting, because that's where we will prevent that ongoing narrative of domestic abuse. But that does mean offering support for people and challenging their behaviour. We are not taking our eye off the ball at all to support the people who are actually in the middle of crisis, so those living with domestic abuse now, and what their risk looks like and how we can best support them. But we also want to really work with partners to understand what recovery looks like. So not just being a survivor and surviving domestic abuse, but thriving and living the life that everyone should be able to live. And what life that they want for themselves can be very, very different to what the state and the system might think good looks like. So as you can see, that's our strategy. We're at the moment refreshing that strategy, but this is the strategy to end domestic abuse. So it's not time limited at all. We are all working together today to make this a reality for hopefully our children, grandchildren, that domestic abuse can be something that is spoken about. It is something that can be shared, and it is something that we can stop. So with that in mind, I am going to hand over to Nikki Kelly. Nikki's going to introduce herself and to be finished at about 1:30.
Thanks, Jo, and hello everybody. I'm Nikki. As it says there, I'm one of the practice consultants on the SafeLives team. We're working with local authorities across the country, looking at practice development and how we really engage survivor voice to develop all of the things that we do in line with the new legislation. So I'm going to focus particularly on local partnership boards. And before I start, I guess it's really important for us to think about why have a partnership board. Yes, of course, it's about legislation, but it's much more about really what difference is it going to make in people's lives? And within that, what actions are the board actually going to take that we're going to make change happen? And then from that action, what are the outcomes that we're able to demonstrate from working in partnership and collaboratively? There's also the aspect of our partnership board which is about governance and understanding that governance between organisations is a linchpin for success of all the partnerships and creating a common ground, because ultimately the environments in which we're all working are complex. Different organisations, different sizes, different capacity, different cultures, different communications and different expectations. So it's important for us to think about that. And alliances can often come with assumptions that because we're working together in the same sector, that we're all on the same page. However, through the partnership board and creating this approach, we can really work towards common goal setting, shared processes and support systems for each other. And these are really important. It's also key for us to think about how to involve people outside the strategy group in your own organisations, doing the day-to-day operations, as this all needs to be aligned to what we're trying to create, and also to be able to demonstrate the impact of what we're trying to achieve. Smaller organisations at a real grassroots level that are supporting people in crisis and on a day-to-day basis won't necessarily have the infrastructure of those bigger organisations, and yet those are the people we need to reach out through to reach people from more marginalised communities or that don't have a voice or perhaps are not engaging with services at all on any level. So these are the questions we really need to consider before we kind of go ahead when thinking about a partnership board. And then how are we really representing people in communities that are underrepresented? It's really good to think about the different communication style. It's good to think about accessibility, and it's good to think about how we're actually reaching out to those people that perhaps won't touch services at all but are going through this experience. So what does a DA partnership board mean to anybody out there who is experiencing domestic abuse on the ground? So these are all some key considerations, and you will all have your own, and you will also all have all of your own systems and processes in your own organisations and in your own communities already. But creating that common goal from what the DA Act places as a statutory framework is good to think about before you start. So safe accommodation in the statutory framework. The Act places a statutory framework for the delivery of support to victims of domestic abuse in safe accommodation, and providing the clarity over governance and accountability, which I've just touched on. It places a duty on each tier of one local authority in England, the Greater London Authority and the Isles of Scilly Council, to appoint a multi-agency domestic abuse partnership board to consult as it performs and contain certain specified functions, to assess the need for accommodation-based domestic abuse support in their area for all victims or their children, including those who come from outside the area, to develop and publish a strategy for the provision of such support to cover their locality, having regard to the needs assessment, to give effect to the strategy and through commissioning and decommissioning decisions, and to monitor and evaluate the effectiveness of the strategy. And all too often we do see as well that can mean lots of board reports and a lot of information for people to read through. So I think it's also a great opportunity to be able to think about how do we evaluate, how do we monitor, how can we be creative in this space that really pulls a thread of authentic voice through every single thing that we do, and to ensure that monitoring and evaluation is also communicated back out to local communities and local organisations that are participating. Next slide, please, Sarah. So to continue, it also has to report back to central government. It requires local authorities to have regard to the statutory guidance in exercising their functions, and it requires Tier 2 councils, district or borough councils and London boroughs to cooperate with the lead local authority so far as it's reasonably practicable. And it requires the Secretary of State to produce statutory guidance, having consulted the Domestic Abuse Commissioner, local authorities and such as other persons are considered appropriate. I appreciate all of this is in the context of a lot of changing systems this year with the development of the integrated care systems. So I think it's also worthwhile considering in this, where does the DA Partnership Board sit within your integrated care system development and all of the other local boards that will be supporting your communities alongside your integrated care area developments, and ensuring that all these touch points, there is a voice for people experiencing domestic abuse as a way to implement the needs assessment and your framework and strategy throughout the whole system. Next slide, please. So in terms of the structure, the statutory duty for local authorities into a local partnership board, through to a needs assessment and out into a strategy that you can then measure the impact. Next slide, please. Thank you. So a multi-agency partnership board will have a core membership as set out in the DA Act and statutory guidance. An authentic voice for adult and child victims is essential, and responsibilities for the partnership board are to assess the need for accommodation-based domestic abuse support for all victims in their area, including those who require cross-border support, to develop and publish a strategy for the provision of such support to cover their locality, having regard to the needs assessment, and to give effect to the strategy through commissioning and decommissioning decisions, and to monitor and evaluate the effectiveness of the strategy. And I think it's probably, again, important for you all, and you will all have all of this in your local areas in terms of how you work together, is thinking about the golden threads that kind of need to pull through all of this. But also to be thinking about the evolving situation with COVID and the backdrop for what's happening with accommodation in your local area and the different pressures that are coming, alongside, as I said, the move to integrated care systems and care areas. So really trying to join up the partnership board and not have it working in isolation. Next slide, please. Thank you. So in terms of membership of the board, and again, this is very much down to your area and how the kind of services that you commission. Chair, representative Tier 2 authorities within the Tier 1 authority, representation of the interests of children victims of domestic abuse, representative of the interest of charities and other voluntary organisations that work with victims of domestic abuse in its area, by and for services, representative of the interests of persons with functions relating to policing or criminal justice in the area, a representative of the Tier 1 authority, interests of adult victims of domestic abuse, a representative of the interest of charities and sectors with victims of domestic abuse in the area, persons who provide or have functions relating to healthcare services, and a representative for housing. There's a great practice from Nothing About Us Without Us many years ago, which also talks about a co-chair with somebody that perhaps experiences learning disabilities, and it's worth thinking about how far you can challenge yourself to be thinking about inclusive practice that is meaningful. Also about how you set up the meetings when we're talking about bringing in authentic voice, the structure, the timings, and how all of that kind of comes together. And certainly in the world we're living at the moment, there is a temptation for meetings just to run on for 7 hours straight with a lot of reading beforehand. And we really need to think about this in the wellness of people as we create our partnership boards and develop our practice, and a great opportunity and a window of opportunity to really develop your partnership boards, your local partnership boards, as demonstrating best practice of the way that we can do things. Next slide, please. So we recommend involving your commissioned and child advocacy service in this process to provide a representative. Consider how young people under the Mental Capacity Act, the Mental Health Act, guardianship, or within the care system are represented. Obviously, we've now had Article 39, so it's also worth thinking about how we might also be involving the voice of people that are going into it, young people going from the care system into independent living that may be feeling more isolated or cut off from services and then potentially at greater risk. It's also worth thinking about, from a health perspective, how you draw together patient pathways for authentic voice. So thinking about patient participation groups around your GP surgeries and primary care networks, and all of the opportunities that you have to reach out and to reach people in their local communities to engage as much voice as possible. And also to think about really engaging voice and not always through organisations. So how do we really support people to come and have that kind of peer support to be able to kind of be represented at a board? So as we said, they're involving your survivor network in this process and providing a representative in turn and the right support. So what with the triggers might be thinking about timings. What works for us in terms of system working doesn't always work for people that have got other commitments. So we need to think about how, where and when we hold meetings. And as I've said, making the best use of existing pathways for people to connect and engage. We also recommend that there are people from by and for victim services, such as LGBTQ, Black, Asian, and people that are minoritized groups where possible. And also really consider, and Joe alluded to it at the beginning, the differences in how communities engage. A rural community, thinking about farmers in terms of the example I used there, and agriculture, predominantly will only engage with agricultural charities and will present in core services only when they reach acute. They also need to be backfilled and have support to attend meetings because there isn't that system, because so many of them are self-employed and working alone. So it's really thinking about, if we want to reach people wherever they are in the communities in which they engage, how are we doing that, and do we have the right partners around the board? So new roles have also been created in local communities through the NHS 10-year plan: social prescribers, health coaches, primary care network coordinators. All of these roles will be supporting people who are experiencing domestic abuse. They will, of course, be referring on to as appropriate specialist services, but they are great points of contact at which people in local, hyper-local communities are engaging. So again, how do we start to really incorporate those new roles, those voices, and the roles and what they do in supporting people to engage with the local partnership board? Next slide, please. I think we have a stick on IT. I think there's an awful lot there in terms of what we need to consider, but I think, and sometimes that can seem slightly overwhelming in the world in which we're all working, but I think there are the integrated care areas at the minute provide a great opportunity in thinking about how can we integrate a local partnership board into all of your local frameworks. And you will also all have best practice examples of what you do already, fantastic relationships. And again, partnership works on trust. Next slide, please, Sarah. I think we are stuck.
And Nikki, I think it's changing for everyone except for you. Your signal's a bit iffy.
Oh, okay. Yeah, nothing's kind of moved on for me, so I will.
Nikki, what slide do you want on now?
Sorry, it's bringing this back up again. So I am on, I haven't got a slide number on here. Sarah, it's where all the pop-ups come in.
Okay, I think we're on the importance of authentic voice, which everyone else can see, Nikki, and we'll do the pop-up.
Thank you. Yeah, so in terms of thinking about the importance of authentic voice, really starting to develop the routes and ways that people can engage with authentic voice, and having the opportunity for people, whether they have complex communication needs, English as a second language, older people, and younger people, it's really starting to think about what is it and what are the systems and mechanisms that we can engage for people to take part into the partnership board. So, sorry, my slides come up now. So as Ursula said, we've walked through fire to get our voices back, and we're not going to give them up now. So to truly transform the response to domestic abuse, we must place the expertise of survivors at the heart of everything we do. And working together as a whole system, we can integrate and amplify survivor voices and interweave these with this authenticity and independence throughout all of our work. These systems and touch points in communities all exist to some degree, and by listening and responding to these views, we can all critically assess and address the challenges together. And so sometimes even down to thinking about leaving is a safe option for some people, actually moving to somewhere that they don't know on the other side of a city, in a community that they don't understand, and perhaps with no support networks, can equally seem very threatening. So it's really thinking about what is going to work from the person's point of view and the family's point of view, and to let people tell their truth and speak with an unmediated voice. To consider victim and survivor communication needs, as I've said, and how best to support them and to engage with them. Many different local community networks exist to help and support this, and through the development of integrated care systems in your area, this provides another opportunity. Sometimes some of those roles are really not that known to services, but yet they provide the oxygen at a very local community level and do an awful lot of informal volunteering and support. So it's really about thinking, how do we get down beyond our local structures to reach those people? And as I've said, thinking about the structure and the timings of meetings. The importance of buy and for services, and anybody, as we know, can experience domestic abuse, and support must be tailored to each individual's victim needs. Buy and for services or specialist services are a vital part of a domestic abuse response. The barriers to support victims of domestic abuse will differ depending on their age, ethnicity, disability, sexual orientation or gender, and buy and for services understand these barriers and are therefore equipped to better support each individual victim needs. Authorities must ensure appropriate and adequate support within safe accommodation meet the needs of all victims, including those with relevant protected characteristics or multiple complex needs, and whose support needs may not be able to be met within generic domestic abuse safe accommodation. And as we know, we see people that come along with life is never straightforward. And you're not, as we've already, Tamar already outlined, it's not how you identify. You're a whole person within a whole community, within a whole system. And it's really thinking about the person and the family in the round. So just actually having to think about safe accommodation, it's about thinking, can the children get to school? Can the person go to work? Is there transport needs involved? And how are we enabling rather than disabling people's ability to get back on to their feet, and not just to survive, but to thrive? Next slide, please. We must consider intersectionality in the needs of and the specific barriers to victims who may fall into one or more protected characteristic or unique complex needs. The additional barriers for these groups must be taken into consideration when commissioning safe accommodation and services tailored to meet their needs. And we must listen to those dedicated services who have expertise, specialist knowledge, and the perspective of those who they represent. And I guess just to kind of, for me, in terms of talking about the partnership board at the minute with COVID, we're also seeing additional pressures on services. And we're also seeing additional pressures on families and people in different circumstances. COVID as a fear where people aren't allowed into the home, for example, because they don't want to be put their older relatives at more risk. So what are the prevalent and rising issues around domestic abuse for your local community? Is there a higher risk of carer burnout? Is there a higher risk of financial abuse, because we have more people getting involved with people that perhaps don't have capacity. So it's really thinking about what's happening in your area and what are the priorities in terms of safe accommodation and approaches for your local partnership board, and then being able to have to be able to act and to be able to report and to demonstrate the outcomes. Next slide, please. And now I'm going to hand over to Lily Green, who's the Healthy Homes Officer for Leicestershire County Council. Thank you.
Hi all. First of all, I'd like to say thank you for joining us today. We're really grateful for you getting involved and coming to listen to what it is that we have to say from all different specialist organisations. So thank you for that. So I am the Healthy Homes Officer at Leicestershire County Council, and the reason behind joining you today is to discuss the survivor voice / the authentic voice work that we're doing across Leicestershire County Council. Can I have the next slide, please? So there it is. So the local partnership board. So Tier 1 local authorities must appoint a local partnership board consisting of key partners with an interest in tackling domestic abuse and supporting victims, including their children. Tier 1 local authorities should ensure that the board adequately considers the factors in the voice of the victims or service users when making local decisions. Consideration must be taken as to the appropriateness of how this is approached. Local authorities may wish to have direct representation from a victim on the board, or alternatively through a separate dedicated forum specific to hearing the voices and views of victims, a representative of which can sit on the board. So the reason as to why the authentic voice is essential in your local partnership board is because we can have the overall picture of the quantitative data from local domestic abuse organisations or local charitable organisations and social care and the police. However, it's not often that we work with members of the community to get their voices put across and to put their voices or represent their voices adequately in strategic work that we do. So why is it essential for victims and survivors to be included in the process? It's vital that victims and survivors have a safe place to disclose their experiences and share their expert knowledge on the subject. Quantitative data can capture the extent of the local issues around domestic abuse, but as I've already said, local organisations may not have the qualitative data that backs up that evidence. Involving authentic voice brings opportunities for survivors to speak out and for them to come forward and liaise with strategic leads or organisations about what it is that they're experiencing on the ground, what barriers it is that they're facing, some of which may not be able to address those barriers with organisations that they're involved in. So if they're involved in local domestic abuse charities, they may not feel confident or comfortable to speak out about how they're feeling, whereas providing them the opportunities to speak to somebody outside of those organisations may encourage them to speak out. Can I have the next slide, please? So key to the success of our local services is embedding the voice of survivors and taking an evidence-based approach to commissioning services. It is through feedback from service users where we can start to identify gaps and needs locally. Having these voices heard and validating these within local partnership boards are essential. It is essential that we build what we do in Leicestershire by understanding in depth what is happening through both qualitative and quantitative data, identifying opportunities and strengths, then co-creating with key stakeholders solutions which are based on what works. Can I have the next slide, please? Why should obtaining survivors' voices be at the heart and start of the issue? So victims and survivors have the most authentic understanding and experience of domestic and sexual violence. No organisation is the expert to a victim's experiences. They are the expert in their situation, and it's only them that knows truly what they need in that situation. Victims of domestic abuse are the experts. No professional or service has the ability to understand individual needs of the service users that require support. No service should provide a one-size-fits-all approach when supporting victims of domestic abuse. Every experience of domestic abuse is different. Some victims suffer from long-lasting effects such as trauma and post-traumatic stress disorder, and some are able to overcome this with a lot less intervention. If we build services around what service user state they would have needed to leave their situation initially, we are more likely to provide a preventative approach to support and see a lot less victims walking through the doors requiring support for ongoing abuse. Partnership board common goal setting, sorry, bear with me. Next slide, please. I was waffling then. So how are we reaching out to members of the community across Leicestershire? So Leicestershire is a tier 1 local authority, and we have 7 districts under 7 tier 2 districts underneath us. So what we have done is we have a local partnership board consisting of the district representatives and the tier 1 local authorities, social services, children and family services, adult social care. We have local charitable organisations and specialist services, so Black minority and ethnic services, and so on and so forth. So liaising with local domestic and sexual abuse organisations, collating quantitative and qualitative data through capturing real life case studies, attending refuges to discuss this work in house meetings. So we'd put out some local comms across across the organisation internally and also externally, so using social media to reach out to victims and survivors that may not have been able to access services or may want to access services but don't know how to go about it. So what we've done is we've put out local comms to try and get service users to come forward and work with myself on this work to help us to identify barriers and help us to build on solutions or find solutions that we can put into place to prevent these barriers from occurring in future services. So one of the things in which I'm doing at the moment is attending all local refuges across the county to speak to survivors that are currently residing in local refuges to get their opinions on their service. So what service it is that they're receiving, what barriers they had in accessing services initially. Maybe they had to wait a while to be offered accommodation that was suitable to their needs, and so on and so forth. Can I have the next slide, please? So why should obtaining survivors' voices be at the heart and start of the issue? So victims and survivors have the most authentic understanding and experience of domestic and sexual violence. Victims of domestic abuse are the experts in their situation. No professional... Oh, I'm reading this slide all over again. Bear with me. Sorry. It's because I'm reading it off my laptop. So what information is gathered from victims and survivors? To understand from survivors what type of help and support it is that they need, to understand the services that survivors access and the extent to which they meet their needs, to understand the safe accommodation services that survivors access, the barriers to accessing that service and the extent to which that service meets their needs, to understand the support needs of the wider family and to what extent they were met, and to understand what an ideal support offer would look like. Can I have the next slide, please? So aims of the focus groups and the one-to-one meetings that we're running locally is to gather the end-to-end journey taken by DA victims and survivors and their children in trying to access DA support within safe accommodation, to establish the current pathways of support and what that looks like from the victim and survivor's perspective, and to gather the experience accessing and receiving support through Women's Aid, the strengths and the weaknesses of the service. Can I take the next slide, please? So objectives of the focus groups and the one-to-one meetings are to influence best practice guidance to reduce the prevalence, likelihood and harm of domestic and sexual violence and abuse on all, to use expert knowledge and experience to inform future delivery on DA and SV services, and to include service users' voices in staff meetings and feedback any strengths and weaknesses of the service. So how we're looking to do it is to run focus groups, and if there's any survivors within the focus groups that wish to be the voice on the board, then they are more than welcome to do that. If not, then I'll be taking the voice of the survivors back to the board and ensure that we use their voices to shape future service delivery. Can I have the next slide, please? So information required to inform service provision. So was the service accessible? Was the service culturally sensitive? What support works for you? What could services have done better to support your individual needs? Do you feel heard and listened to? And were you denied access to safe accommodation? If so, what are the reasons? And just to provide a bit of context behind that question, there is often service users that are turned away that have multiple vulnerabilities, so those that have significant mental health issues or substance misuse. There's not always accommodation that meets their individual needs. So it's if they were unable to access accommodation locally, why was you unable to access it, and what could we do to ensure that we can provide accommodation to suit those needs moving forward? And I think that is it from me. So thank you.
Thank you very much, Lily. You've got quite a unique role, I think, and I think there's lots of food for thought there. I'm just going to hand over now to the Lioness Tamar. And if the Lioness Tamar is ready, we will go to you and your presentation. Thank you very much. And don't forget the chat box.
Hi, thank you. Fantastic presentation so far. And yeah, I'll get into mine. So hi everyone. Tamar, I go by the name Lioness Tamar. And that's because of my own lived experience of being a survivor myself, and now setting up my own organization. I support other survivors. So I'm an author of my book as well, The Lioness Uncaged, and I'm a trainer. I've recently been recruited by SafeLives as an associate delivering domestic abuse training to the UK police, and I'm a speaker. I'll move on to the next slide, please. So, oops, yep, that's it. So today I'd like to talk to you about the importance of specialists buying for services. But before I do, I would just like to share a little bit about my own journey. Of setting up and running my own specialist support service, which is called the Lioness Circle. But if you wanted to read more about my lived experiences and how I got to where I am, you can get a copy of my book from Amazon, which is called The Lioness Uncaged. So at 5 years old, I was sexually abused by a family friend. At 8 years old, I was sexually molested by my stepdad. And around 13 years old, I was drug raped by a church deacon who is a family friend. So from what we know about, these horrendous start to one's childhood, I had very, very poor life chances. I was also born in Jamaica, in poverty. My first memories even around homelessness, and though some of those factors massively increase the risk of these experiences happening to me. And there was lack of family support. Whilst we were a big family, everyone was in their own challenges. So it was quite challenging then to help someone within that situation at the time. So we actually migrated to the UK as a way of surviving domestic abuse and sexual violence. Whilst I was being sexually abused by my stepdad, my mom was also being violently abused in so many ways. Migrating to the UK, many people think that once you're out of the abuse, you're fine, so get on with your life now. And I believe that's not the case. I ended up in many, many other challenging situations where I've been re-victimized, I've faced racism, just a large other types of challenges I faced as a result of those earlier challenges. And what changed? I think that's the next slide, please. Well, yes, the impact, the experiences that I've had, it's basically impacted my identity in terms of how I saw myself. I saw myself as this disgusting piece of thing that nobody cares about. And, you know, it's about that self-fulfilling prophecy that I saw myself living. I was suffering from all kind of mental and psychological impact without even knowing until I was formally assessed, which, you know, had already taken up more than half of the life I've now lived. It affected my education, it affected work prospects. I ended up in gang, you know, committing crimes that massively affect my confidence. I couldn't even think of living to see 30 years old. I'm grateful that I've recently celebrated my 36th birthday, but at the time I couldn't even see myself, in that capacity. So what changed is the next slide. So basically, I received one-to-one mentoring. That was the start of the changes. I've had years of therapeutic support since, but it's like I needed something to bridge the gap. Sorry, one second. Sorry, 1 second, guys. Sorry about that. I've also got my young one at home today. So, but yes, what changed? So, although there can be so much support out there, I found that I needed someone to help me believe that the support was realistic for me. And so the one-to-one mentoring I received basically break down many of those barriers. It gave me context to the bigger picture I was in, so I could see myself and where I could impact those changes, those positive changes in my life. So it empowered me mentally. It was also from somebody of a similar culture to me, so I could see myself in them. They had gone through so many challenges, so I believed in them that they knew what they were talking about, and I trusted them because they've gone through these challenges and now they wanted to help me. I didn't think they had anything to gain. In fact, it wasn't even paid mentoring. So I felt they genuinely wanted to support me. And the way that they communicated to me, it was in a non-judgmental, unbiased way. It was very creative. You know, they would use real life experience as we're sit there and it's unfolding. So it was very creative, and it felt they genuinely cared. So then what that did was break down all the barriers that the trauma and the lived experience had built up, and then it opened me up to actually receiving what they then had to say and then benefiting from that, which basically I ended up going to college, redoing my GCSEs, A levels, university, getting my law degree, and moving on to establishing a corporate career, which I then gave up to set up my own organisation, and that also led to the Lioness Circle, what I set up. So move on to the next slide, please. So in 2015, basically, I ended up coming out on social media about my lived experience, which, you know, not advising everyone to do that, but that was my experience, and it made me want to meaning and purpose in my life. I set up my own community-led organization now called the Lioness Pride CIC, and